President Obama again trying to fix the Affordable Care Act, bowing to mounting political pressure. The president said today he will now allow insurers to extend their canceled health care policies for 1 year, maybe even longer, even if the coverage falls short of the new federal minimum standards. Now, speaking to reporters at the White House today, Mr. Obama admitted his administration had botched the rollout of the new health care law, and he said he regretted that his assurances that Americans could keep their health insurance plans if they liked it, that turned out to be wrong.
I think it's legitimate for them to expect me to have to win back some credibility on this health care law in particular, and on a whole range of these issues in general. And, you know, that's on me. I mean, we fumbled the rollout on this health care law.
And House Speaker John Boehner did not mince words on his prescription for the health care law.
Promise after promise from this administration has turned out to be not true. So when it comes to this health care law, the White House doesn't have much credibility. And let's be clear, the only way to fully protect the American people is to scrap this law once and for all.
John Harwood joins us now from Washington with more on this. You know, John, a lot of people wondering and questioning today, can President Obama make these rules changes? I mean, after all, the Affordable Care Act is the law. Does Congress at some point have to vote on this? I mean, talk us through how the process is going to work.
Well, first of all, Susie, I think the thing to remember about this is mostly about the president trying to provide political cover for Democrats and for himself to buy time until the exchanges are going to work. The website will be fixed. He's not compelling any changes, and he's not giving a huge new grant of authority to states. What he's doing is saying that if state insurance commissioners and insurance companies want to extend policies further, they can. But the reality is that most of them don't want to, because they want to move into the new world of insurance under the Affordable Care Act. So it is not clear at all how much this is going to change. It may extend some policies, and at the very latest, unless there's an additional decision taken, some of those policies could go to the end of September 2015, but it is not likely, so far as I can tell, that this is going to make a wholesale change. What the president was trying to resist gutting of Obamacare, and this is a minimum fix that he's trying to offer. Yes, as you mentioned, John, this is providing political cover for those Democrats in the House who face re-election next year. But the fact that the White House tonight acknowledges that this fix could extend beyond 2014, beyond that election year, that sounds rather ominous at this point for trying to fix this whole thing. It could, but I think that probably amounts to less than meets the eye, Bill. And the reason is that the administration, they said that in their letter that was sent to state insurance commissioners earlier today. So we've known that for most of the day. But what they are counting on is that the website will be working, people will see better options than the extension of these policies, and will be fine with moving over to the new system. That's why I said they're trying to buy time and get over this rough period that they're in right now. John Harwood in Washington. Thanks, John, for the political angle of that. Let's talk about logistics, though. Many insurance companies said today they are worried about the president's fixes, saying that it could destabilize the insurance market and result in higher premiums for consumers. Let's turn to Bertha Coombs, who's been following this story all along. What do these fixes mean for the insurance industry?
Well, because it's voluntary, it's something that they need to now take a look at. And essentially, the insurers have turned a page on these plans. So they haven't priced what they would be for 2014. So effectively, they now have a 30-day window that they would have to try to do this, because people who want those plans that are expiring on December 31st to be able to renew them for January 1st, they have to put their premiums in and pay them by the 15th of December. So here are the things that they would need to do in the next 30 days. They would need to figure out what the price is on those plans, calculate all that for 2014. They would need to get approval from state insurance and the state insurance commissioners. Washington State weighing in this afternoon saying they don't want to do this. And then they need to be able to get those plans out to their customers and collect their premiums, all in the next 30 days.
So it sounds like you're saying that this really is, not feasible to do in 30 days. Will the insurance companies now fight back on this, or are they going to have to do what the White House wants them to do?
Well, essentially what's happened here is kind of like when you play your mom off your dad kind of says, hey, it's not up to me, ask your mother. She'll make the decision. The president has now shifted the decision to the insurers and the state insurance commissioners. Aetna essentially says, we can try to do this, but we would have to get expedited reviews from all of these state commissioners in order to do that. And it is a logistical hurdle for them to do that over the next 30 days. Cigna said they are already working with a lot of their clients to try to figure out a way to extend these plans, so they may be partly along the way. Some of these insurers have actually offered early renewals. One man who I talked to, his plan was canceled. He had an early renewal that, in order to sort of skirt the ACA rules, went until December 1st. So that one could probably be extended until the end of next year.
There is a bit of a catch-22, though, because the president had said he'd hoped that those who'd had their policies canceled would find a better policy under ACA. But if the website's not working, it's tough to do that kind of comparison shopping.
Well, and it's also tough for the insurers because these are people who already are good about paying their premiums. They already understand insurance, and they're already committed to buying insurance. And if they're not buying on the exchange, that really throws into question the viability of that marketplace.
Real quickly, in just a word or two, what does this mean for premiums? If you have your old policy and you want to, reinstall it, or new policies, are they going up, prices?
I would imagine. I mean, the insurers have to figure out what the price is. They've already seen some pricing trends in terms of medical cost trends going up, so they would need to raise the plan rates.
We'll get back to you on all of that as
Thanks,
you know
Bertha.
more.